Thank you, Minister. First of all, I want to congratulate Minister McEntee and her husband Paul on the birth of their baby son this morning. I think that's really good, and I would just want to congratulate both of them. I also, Minister, think today gives us great hope. Restrictions such as inter-county travel, masses, hospitality, click and collect, barbers and hairdressers will be opening soon, and this is really positive. And I think for people's mental health, Minister, I think this is so important that we now look forward, because today, hopefully today, and I know it will be from listening to the radio coming up this morning, things seem to be really positive, and hopefully this evening the Taoiseach will be announcing all these. But I also want to welcome that from next Tuesday, families will be able to schedule 4 visits to a nursing home. Mental health has been hugely impacted by this pandemic, and as we see more vaccination, are we going to see the reopening of day services in the mental health sector? I know there have been virtual sessions and some one-to-one visits, but it is so important to get back to in-person services. I want to commend Alone, their staff and volunteers, and the National Support Line set up in collaboration with the Department and the HSE. They report that in this past year they've received 49,000 calls to the helpline and made then over 138,000 phone calls to older people who needed support. They highlight the negative impacts on mental health and physical health of this pandemic on older people. Alone have called for a stakeholder group for older adults to inform government on ways to support older people now, as we supported them in the pandemic. Can you tell me, Minister, is that something you are looking into? As we reopen cautiously, and I know we have to be very cautious, I want to ask you, what are we doing to help and support these older people who report continued anxiety? When will the messaging tell them they are safe? Many community services for older people are still closed, and in some cases home care has been stopped and families have been unable to visit because of continued restrictions. Minister, I know you spoke there about you said yourself about the day services, and I want to welcome that, but what is the roadmap? What sort of campaign are we having? What sort of information are we doing? Because communication is key here. Maybe you might come back to me with some answers. Thank you very much, Minister.